Hi everyone, today we have a 40-year-old female patient who presents to our clinic with throbbing and spontaneous pain in the upper right quadrant. So why don't you take a minute to take a look at this panoramic radiograph and perhaps try to determine where the pain is coming from. When you look at the first maxillary right quadrant, you should recognize that first premolar has now been extracted, but as you go toward the posterior area, I hope you recognize that there is an impacted third molar. As a matter of fact, from this view, it looks as though the third molar is superimposed over the root apices of second molar. Additionally, below the crown, you see large radiolucencies involving the cervical region of tooth number 2. Why don't we take a PA of this area? So here we're looking at the periapical film, and we can now much better visualize the relationship between the two. Once again, we can follow the outline of tooth number 1, which may not have caused a resorption of the roots. Additionally, you can see multiple areas of radiolucencies, suggesting that there's quite a bit of destruction and loss of tooth structure. So when you look at this, what would be your differential diagnosis? If you have said this is a resorption, I completely agree with you. And that's what I think it is. We're looking at either external or internal resorption. So why don't we discuss the differences between the two? External resorption, as the name suggests, resorption occurs from the outside of the pulpal chamber, typically from the root surface, and then extends internally or inwards, whereas internal resorption occurs within the pulpal chamber or pulpal space, and it grows and expands and typically has a kind of smooth outline. Given the patient is having a spontaneous pain at night, based on that clinical presentation alone, I would lean toward internal resorption, because external resorption can certainly cause spontaneous pain, which I have seen clinically. However, it's much less common. Patient with external resorption may completely be asymptomatic, and that is very frequently the case. But the features that I see here would also force me to certainly consider external resorption, where if you look at the way these are resorbed, I don't see a nice smooth outline or blooming effect of internal resorption, but rather it looks like it's been somewhat irregularly been resorbed. Additionally, this area, it's a little difficult to say whether there's recurrent caries underneath or not, but presuming, okay, there's a presumption that this is a part of resorption rather than caries. It's hard to explain how, the fact that this is a separate lesion from this larger radiolucency, how does this come about from from a pulpal tissues? Yes, you can have a mesial pulpal horn that would extend out this way, but I would again expect enlargement of the mesial pulpal horn, whereas this appears to be separate from the main radiolucency, and also it extends to the root surface or the tooth surface. So based on the radiographic features, I have, I think, enough features to suggest that this is external resorption. So if you have said either internal or external based on what we have now, both are very, very, I think, acceptable answers. But in order to rule out or to get a definitive diagnosis, I think we need a cone beam CT scan. Having said that, let's talk about this, the potential treatment options. Given the extensive resorption patterns that we see, I hope you'd agree with me that this tooth has a poor prognosis and most likely needs to be extracted. And in doing so, most likely this is going to become a surgical extraction where the crown would fracture off at the level of the crest and the roots would have to be individually removed. But the complicating factor is that we have an impacted third molar right in this area. So what happens when we extract the root if we expose the crown? It may, again, or may not heal very well, right? And also, if you decide to extract the third molar at the same time, it would be a very difficult extraction and may end up causing a large bone loss and subsequent alveolar ridge defect when you're trying to attempt removal of this third molar. So it's not an easy case, right? Extracting number 2 alone may cause a certain potential complications with healing, and even if you decide to remove this, again, you're going to cause a lot of bone loss. If you decided not to remove this, and let's just say that the ridge healed perfectly, okay, ideally, but then what is our restorative option? We won't be able to place dental implant. That's another thing that we have to consider because of the crown and the position of the third molar. So yes, there are a lot of things that we have to consider other than simply recognizing what this is. So that's my main point of this video. Again, I hope it was helpful, and hope you're enjoying my new videos and this YouTube channel. Thank you very much, and take care. Talk to you next time.